So I'm here with Dr. Dustin Sulak, and you've just spoken to a full house out there at the United Patients Group Medical Cannabis Conference. This is the second time you've spoken to our group, isn't that right?
It is.
That's great, that's great. And so you have a practice that started in Maine, is that correct?
Correct.
How many patients are you interacting with or treating on a regular basis now?
Altogether, with our 2 clinics in Maine and then our sister practice in Massachusetts, we're seeing somewhere between 18,000 and 20,000 patients.
Wow.
And these are all real patients. These are people that have real medical conditions that qualify for cannabis based on the state guidelines that we adhere to.
Right.
And most of them have been through conventional medicine and were dissatisfied with the results they got there. So they've turned to us for integrative medicine and cannabinoid medicine.
Wow, that's impressive, and it's an impressive number of people in a select region of the country. And so, as far as the progress that's been made in medical cannabis, even from the legalization standpoint, now there's 24 states that have adopted some form of medical cannabis legalization, and 4 states with legalization recreationally, and California may soon follow in. It's on our ballot in November. But where do you think this needs to go? Where is the next step? Where could the United States take medical cannabis and lead the world in medical cannabis? Or do you think they can?
I do. I think that we can. Maine, for example, has a really good medical program. So we have about 13 different conditions that are on a list of indications for which I can qualify a patient. There's still other conditions I would like to see added to the list, but we have the core of what we would like to treat with cannabis there.
So
and then,
is that unusual to have that many different ailments or different conditions that are allowed to be treated within the state of Maine, for instance? Is that larger than most other states in the country?
It's a little broader than most states, but
Okay.
then there's also 2 states, California and Massachusetts, where a physician can certify any patient to use cannabis
Really?
if they think that cannabis would help and if the patient has a debilitating condition. So that's where I would like to see the rest of the country go, because right now it's policymakers mostly copying and pasting from other states, and then through legislative action we can add conditions, but they're not in the clinic. They don't know for what conditions we would want to use cannabis.
Right.
And so really leave it up to people that are experts in this emerging field of medicine to decide, well, the risk-benefit analysis is in favor of cannabis for this patient. I'm going to choose to certify and treat them.
Yes.
But going back to your question about where we're headed with legalization, I think that one of the most important things concerning the practice of cannabinoid medicine is the availability of the right medicine. So more and more we're seeing standardized cannabis preparations that are produced responsibly without toxic solvents, without pesticides and other synthetic chemicals in there. And they're at a dosage where the clinician and the patient know what they're getting. And so that informs this whole practice. And then we have this feedback loop where we can start to say, wow, this is working, this isn't working. And we're rapidly learning more about how to get optimal results with patients with the least side effects when we really know what's in the medicine. How many milligrams of THC, how many milligrams of CBD, some of the acidic cannabinoids. And even in terms of inhalation, it's still nice to know, based on the strain that someone may be vaporizing or smoking, what are the constituents of that particular variety of cannabis, and what effects can we expect to see with it?
So do you see that then? I mean, it sounds like the government really has to get behind this, because it's a huge effort to try to control or to have quality control even in the end product that's reaching the patient, and then of course the optimal dosing and the method of delivery and all that, like you're mentioning. Do you it certainly seems to me that our country gets behind the pharmaceutical industry and development of new drugs and whatnot. Do you feel that things are favorably swinging? We're coming to that time here in the United States, and when it comes to medical cannabis?
So when it comes to quality control, especially of herbal medicine and artisanal medicines, I would rather put that in the hands of the free market. Let that be a consumer-driven movement rather than government regulation.
Right.
Because the regulators always seem to be a few steps behind where we're at currently, and they end up just holding us back. For example, in Maine, we've been testing cannabis there for 3 years. We just passed a law last year that will allow the dispensaries to label their products. So they're still not even allowed to label it. The dispensary might test test it in our lab,
Right.
get the test results, they can't even put it on the label for the patient to read. They're not allowed to. So that's an example of why
Wow.
I don't want the government to be in charge of quality control.
Yep.
I think the free market can handle that just fine.
That's actually fascinating, and it makes a ton of sense to me as well. So you just finished a fascinating presentation to the audience here at the United Patients Group Cannabis Conference, and you've started a new program yourself called healer.com. Is that correct?
That's
Can you
right.
tell us a little bit more about Healer?
Sure. Healer.com is a patient education website that basically has all the education we found ourselves taking a lot of time to deliver to patients in our clinic. You know, we recognize that cannabis is a different medicine, and a lot of people, especially we've had a lot of people that are brand new to cannabis. Some of
Right.
them don't even understand exactly what they're coming in for. They think cannabis means marijuana, but they're not sure.
Right.
And so we developed a new user program that really holds their hand and walks them through what it's like to start. There's a shopping guide, there's a very specific dose titration schedule, a guide to help them figure out how to get into cannabis without having adverse effects that might turn them off, and how to get the optimal benefits.
Right.
And we have a lot of other programs that are good for people who are currently using, like how to strategies for non-psychoactive use, for example, how to switch from inhalation to using liquid medicines.
Okay.
And one that's really popular, how to sensitize the cannabinoid system, which is a 6-day program that helps people reduce their dosage, make their endocannabinoid system more sensitive, and get better results with their cannabis. So they save money, they have less side effects, and overall they're using less.
That's interesting. So it's actually a 6-day program that helps them to reduce the amount of cannabis they may be utilizing, but have it be more effective and more specific to what their needs really are.
Exactly.
That's great. And so how can people find out about Healer? Obviously it's on a website, but
Yep.
how do they access
Yep.
the programs and whatnot?
So healer.com, it's free. We invite people to give us a donation so that we
Okay.
can continue to make more content, and we share that donation with other nonprofit cannabis groups like United Patients Group right
Right.
now. If anyone donates to healer.com, half of that goes to UPG to
That's
support
great.
their educational efforts.
That's
And
great.
we'll continue to choose other good cannabis organizations that are in this for the right reason to help patients.
That's great.
And hopefully continue to make more content. But all the content is on there for free at healer.com.
Okay, that's awesome. So I have one last question for you. So when you started practicing medicine and working within the healthcare world, did you pinpoint cannabis as what you were going to focus your practice on, or how did medical cannabis start to become a part of such a rich part of what you're doing for your patients?
It absolutely chose me. I had an interest in cannabis when I was in college. I worked for cannabis legalization, and in medical school I did a rotation with John McPartland, a cannabinoid researcher. I was interested in it, but I started a private practice after my residency training focused on osteopathic manipulation, hypnotherapy, and integrative medicine. I had no plan to be a medical cannabis doctor, but I certified one patient for seizures, and then he told someone, and the next week I certified another patient for cancer, and then the next week 2 more people came, and then the next week 20 more people came. At the time, Maine had just passed a new law that updated their medical cannabis program that allowed more conditions. Basically, chronic pain was added at that time. It wasn't on there previously.
Oh my God.
So suddenly, there was this huge population of chronic pain patients now that needed a doctor. There were basically 2 in the state that were willing to do so. The other one, he was a faculty at my residency program, and his practice was full. So here I was trying to run a micro practice, and we were turning away 200 or 300 people a month saying, call back next month to schedule 2 months out. And the practice just grew so rapidly. So we started finding other providers that were interested in what we recognize is an emerging field in medicine. So we have cardiology and neurology and endocrinology, and there's clearly a need for a subspecialty field of cannabinoid medicine.
Right. That's fascinating. Thank you so much for being here at the conference, and thank you so much for everything that you do for thousands and thousands of people across the country.
My pleasure.
Thanks
Thank
for
you too,
being
Michelle.
here.